and gentlemen, as you can see in my slide, this is the first RNP plate that was published back in 2015, together with my team, Dr. Osama Hamdi, Dr. Hassanin, Dr. Inas, and I'm glad this plate is now become instrumental. So if you search Ramadan plate, it will be made available in various websites, social media, blogs, talking about promoting healthy eating during Ramadan. And I believe it has improved the diet among patients with diabetes, as well as the community who observing Ramadan fasting. Hence, it is no surprise, we totally understand that Ramadan trained us self-discipline, not only about physical, food, behavior, and by right, it should help patients to improve the therapeutic adherence. In general, fasting, even without an effort, is helped to reduce an energy intake, roughly around 240 calories. And therefore, it's induced small weight loss. And among patients with diabetes, even no intervention provided, as been shown by various speakers, it's also helped to reduce their weight. And among those who wanted to stop smoking, Ramadan is a period where they should start. But ironically, food has been more commercialized during Ramadan than any other months. As you can see in the slide, this is my content that we're gonna discuss. We will look into diet pattern during Ramadan. Of course, we will revisit the Ramadan nutrition plan that was published last year, and that's clearly the fundamental of Ramadan focus, a structured nutrition therapy, and the takeaway. So let's go to the first topic. Does Ramadan increase food consumption, and how does the pattern look like? So Google has analyzed 1 billion of search on social media during Ramadan, and they found that food was the main theme in Ramadan. As you can see, is increased almost more than 100% in Malaysia and more than 200% in Indonesia. The interest is also increased in male and female with different direction. Like in female, the focus is more on dessert and recipe during Ramadan, whereas among male, the focus are about eating out and basically the restaurant, the barbecue that they are looking for. Out of curiosity, I would also like to look at into the economic impact of Ramadan as well as the food waste. And clearly, both studies have shown that the food consumption pattern has increased tremendously, at least in 83% of the families, as well as the food bill. But sad to say, the amount of food wasted is also higher. If you look at into the data, that's a lot of about 20% of food that was good before it was thrown away. And this is enough to feed at least 6% of Malaysian population during Ramadan. How about those in terms of dietary intake? These are the two studies that was recently published by a group in Lebanon as well as in India, and both of the study agreed that there are major differences in dietary intake between Ramadan versus the rest of the year, where both studies showed that there is an increment in refined carbohydrate and sweet, and a drop in food that are such as cereal-based product, protein-based milk and dairy as well. And in Indian study, indeed, they found that Ramadan induced or promote more sedentary work routine, which ultimately lead to the increase in body weight and BMI after a month of Ramadan fasting, the effect that we do not want to see. Nonetheless, both of the study were conducted among a non-diabetes population. But before we move to people with diabetes, let's look at into this nice review by a team from Singapore, where they look at into the common food consumed during Ramadan. And the diet here as well represent increase in sweetened beverages, traditional sweet snack, especially, for example, in Singapore, you can see the starters start with dates or traditional sweet snack, and they are also increased in sweetened beverages, like we call this sirap bantung, which I believe a similar dietary pattern or meal pattern that we also observe in Malaysia, Indonesia, and perhaps Brunei. So among people with diabetes, Ramadan nutrition practice are still not optimal. In our previous survey, we found that there are patients who will still skip sahur, and they had early sahur before they go to sleep. They increase the consumption of food and sweetened beverages as what we have seen as well in general population, and they become more sedentary during Ramadan. What concerned me more is that only 1/3 of patients with diabetes receive specific Ramadan nutrition education. And that's perhaps explain why their Ramadan nutrition practice are not optimal. Before we conduct previously back in 2019, we explore the opinion of our patient regarding fasting during Ramadan. So when we posted the first question during the focus group discussion, issues that they experience during Ramadan fasting, none of them expressed their concern. They said that no issue at all when it comes into Ramadan fasting. But when you probe further, they start to tell us more that they experience a lot of physical issues, and which this looks like representing the hypo that they perhaps experience but did not be able to explain. And when it comes into food intake, majority express their concern that they unable to reject or to withstand food temptation. And they also feel that Ramadan is a period where they increase in appetite. So therefore, it is really stress and emphasize the needs for the structured nutrition therapy with Ramadan focus, which should be delivered before Ramadan, as explained by various speakers, especially Dr. Suziani, on the aspect of pre-education before Ramadan and the benefit. Here, I would like to explore what is the component of Ramadan focus, structured nutrition therapy, and whether it is more beneficial than the usual care. Therefore, before we move further, let's revisit the Ramadan nutrition plan that was published last year, because it is the foundation to most of the Ramadan focus of a structured nutrition therapy. So in this Ramadan guide that was published last year, the Ramadan nutrition plan was at chapter 8 for people with diabetes. We totally understood that nutrition is a critical component during Ramadan. As you can see in the first earlier presentation, I have highlighted how food become the most common topic that has been searched by most people in the world. And in this RNP, it includes 5 main components that we provide pre-Ramadan nutrition education. We talk about the risk and nutrition issues that patients should understand. We provide the calories and the appropriate carbohydrate distribution, and the whole RMP is guided by the 10 principles. And of course, we provide country-specific meal with transcultural experience. And this is suited to the needs of Ramadan focus expressed by the patient during the focus group discussion, where they also highlight the requirement, the needs of understanding on how they can manage hypo and hyperglycemia during fasting. And they also request and really hope to have a transculture menu plan for specific country, and in this context for Malaysian, that include 1-day menu, specifically, especially for sahur, because usually sahur is quite challenging for them to think about the menu, and perhaps the choice of healthier beverages that they can take during Ramadan. In this paper, we review what is the effect of Ramadan-focused nutrition therapy for people with diabetes. We identified 14 studies, and from these 14 studies, 3 studies use the IDF Dar Ramadan nutrition plan that was published back in 2015. All of these studies found that with Ramadan-focused nutrition plan, is improved A1C ranging from 0.3 to 1.1%. They also reported less hypo in all studies, either events or rate. And the best part, one study reported that the improvement in A1C indeed sustained even before the next Ramadan, which to me, I believe this is a turning point for better lifestyle practices if the overall concept can be practiced throughout the year. Everyone here understand that the structured diabetes nutrition therapy is highly recommended, and it is have an outstanding benefit, not only to diabetes related outcome, but as well as for diabetes remission. So here I present to you the principle of Ramadan focused structured nutrition that we have adopted last in 2019 when we studied the effect of Ramadan nutrition plan using a structured approach for our patient with type 2 diabetes. So in this principle, we use the RNP as a key strategist, the fundamental aspect of the intervention, where we let the patient before the Ramadan to understand what are their appropriate calorie and carbohydrate prescription and distribution. We strengthen their MNT component, medical nutrition therapy component, especially related to carbohydrate management. And we teach them about the Ramadan plate that I have shown you earlier, as well as provide them with 14 days menu, including a healthy snack option and beverages. Since Malaysian patient is always require a specific information to further optimize their target, so we create a component that we think that will help them to treat better to the target. So here we introduce the use of diabetes formula to be incorporated as part of the calorie meal plan. We optimize the blood glucose level, especially after meal. Yeah, many of the speakers highlight hyperglycemia, especially after iftar. And this is where we introduce the concept of meal sequence. And of course, the structured Ramadan nutrition plan need to be delivered by a trained personnel, and in this context, a dietitian who familiar with the overall program. The treat to target is critical, especially when we look at into the diet of our patient, mainly during sahur. You can see as well in this slide, where majority of our patients, when we do a survey before they start the study, we ask them, which one is your common sahur meal? And majority say their sahur meal is simple, usually very minimal protein and rich in carbohydrate. Whereas during iftar, as you can see in the slide, the diet is complete, but perhaps maybe too much, that rich in carbohydrates, sweetened beverages, as well as high in sugar and fat. And therefore, the use of treat to target will help them to understand how to optimize their glycemic target. And the diet that I presented previously is imbalanced in nutrient. They are lack in protein, lack in fiber, that will lead to reduced satiety. And this is critical, especially during sahur, where we wanted to have more sustained blood glucose level. And the diet that if there is no protein and lack of fiber, it will increase the risk of hypoglycemia, hyperglycemia, and perhaps dehydration. And of course, the diet that rich in carbohydrate, sugars, will also increase the postprandial blood glucose level after meal. And this may put patient consistently high glucose until the next meal, which is usually eat after the Tarawih. So in our study and in our practice, we provide the eating plan, the 3-step eating plan, where we encourage patients to understand the fundamental concept of diabetes management, where we talk about food of interest. We emphasize the important role of carbohydrate from healthy sources, as you can see in the slide, and don't eat the carbohydrate solo because it will absolutely increase the postprandial blood glucose excessively. And they have also to include the lean protein, the best from the plant-based protein, and minimize the fat. Second, we provide them with Ramadan toolkit, and in this toolkit is include Ramadan plate and menu plan. And last but not least, we emphasize the concept of treat to target. Yeah, as I mentioned, the meal sequence that we introduced, where we encourage and emphasize to the patient the importance to have eat vegetable first before carbohydrate, because we learn from many of the studies that when they eat vegetable before carbohydrate, as you can see in the graph, it's help to reduce the post-meal glucose consistently every after meal, not only in people with diabetes, but also those with normal glucose tolerance. And the use of diabetes-specific formula outside of the Ramadan as part of the meal replacement has been shown effective, not only to improve diabetes-related outcome, but also to achieve diabetes remission together with very low-calorie diet. So here in our structured Ramadan nutrition plan, we do incorporate diabetes-specific formula so that patient will be able to achieve improvement in dietary adequacy and finally improve the glucose control and other outcome. So with these three concepts, it's help basically the needs of the patient to understand what are the food that give them more satiety and easy to prepare as well, especially during sahur. So this is how the eating pattern or the meal patterns look like. So we switch from this to that. We encourage the meal sequence. We use the Ramadan nutrition plan plate, as well as incorporating formula to enhance the overall dietary adequacy. Nonetheless, the incorporation of diabetes-specific formula should be made within the appropriate calories and carbohydrate control. We published recently, following the intervention, we look into the changes in dietary intake among patients following a structured nutrition therapy. What we found that with structured nutrition therapy during Ramadan is help to improve and reduce their carbohydrate intake, increase protein intake, especially during sahur, provide more fiber, and increase the calcium. We also observe a drop in dietary GI, dietary glycemic index, as well as dietary glycemic load, which was also sustained a month after Ramadan. The improvement in dietary intake was also translated or manifested in the improvement in glucose profile, where when we ask patients to record their CGM, their self-monitoring blood glucose, where we found that those following a structured Ramadan nutrition plan has better blood glucose profile before sahur, as well as before bedtime. And that was significantly different between the two groups. The previous speaker talked about the CGM, and in our study, we also found that those following a structured Ramadan nutrition plan able to achieve more time in range, about 80% time in range spent within the normal range, and spending more time in range has been also shown to improve diabetes-related complication, as highlighted by the previous speakers. And the other aspect that what patients need for Ramadan-focused structured nutrition is a group support. We do provide WhatsApp and Facebook, but what I can highlight to everyone here who attending the conference, Dar and Dr. Hassanin, especially the team, has come out with the apps to help for those who have no access to a dietitian, so that you can provide this app, encourage your patient to download. And in this app, it will tell you how much calorie they wanted to have, their BMI. They will be given an education about what to prepare, the potential risks, what are the bad eating habits, and how to manage their weight. We also provide the example and explanation of Ramadan plate. So in this app, we do provide the menu plan as well. And that menu plan is at the moment of time specific to 5 countries. But of course, you can modify accordingly. And I believe they will be a great help to most patients out there. To summarize, dietary intake during Ramadan is not optimal. It's characterized by high carbohydrate, sugars, and refined carb, as well as reduced in protein. And protein is the important component to improve dietary satiety and ensure the blood glucose is maintained throughout the day. We understood that Ramadan-focused structured nutrition provides significant beneficial clinical and dietary outcome than the usual care. This principle, I believe, shall be continued during non-fasting period, and of course, it warrants future investigation. With that, thank you very much, and happy Ramadan.